Hi, my name's Darian and I am recording my Foley catheter video. So I've already provided patient privacy by shutting the door when I walked in the room behind me, and now I'm going to explain the procedure and verify the patient. Hi, my name's Darian. I'm going to be your student nurse today. Can you verify your name and date of birth for me? Okay, perfect. Do you know why you're here today? Okay, so per the doctor order, I am going to insert a Foley catheter in you. So do you have any questions about that procedure or know what it entails? Okay, perfect. Yeah, it will definitely help you urinate a little easier and make things a little easier for you under the circumstances. So I've already washed my hands prior to coming in here with soap and water, and so my hands are clean and ready to start the procedure. I've already gathered all my supplies here, and if you have any questions or if you feel uncomfortable at any time through the procedure, please stop me and let me know. Do you have any allergies to iodine? No? Okay, perfect. So I will be using iodine to cleanse the area prior to inserting the catheter. So I just wanted to make sure that that was not an issue. So I'm just going to go ahead and raise the bed here to a comfortable height, and I'm going to make sure to lower this side rail while leaving the other one up. So I'm going to make sure that I'm using proper body mechanics throughout the entire procedure. And now I'm going to open my cath kit. So after I open it, may not stay. So first thing I'm gonna do, make sure. So this is gonna probably fall open because it's been used, but maybe it'll stay. So I'm gonna go ahead and make like a little trash can for myself, and I'm gonna put that on the foot of the bed. So that way while I'm in my sterile field, I do not have to go around and like try to look for a trash can whenever I'm trying to open all my packaging. I'll just have it right there, and then at the end, I'll just clean everything up at once. So I'm just gonna kind of set this down here at the foot of the bed, and then that way I am not contaminating my field. So next I'm gonna open this with sterile techniques. So I would open that flap first, which it already fell open, so perfect. And then I am going to just make sure I'm touching only the outer edges of the sterile field. So here I have some hand hygiene, but I've already provided hand hygiene. I washed my hands prior to coming in here. So I'm just gonna kind of toss that. And then I also have some things to do pericare, but I've already done pericare on my patient, so I am not going to use this either. So next I have a sterile drape, and this sterile drape is going to be super difficult to keep sterile because whenever you're entering a Foley catheter, usually the patient is unable to help you in any way, and so you want to keep this as sterile as you can, but due to most circumstances, it may be a little more difficult. So I just try to make sure I'm only touching the outside of the outside inch. And I do not have sterile gloves on yet, so I am still able to touch the client's legs and make sure that, you know, it's properly under them while we're doing the procedure. So now that that's done, I can touch the outer edge of my sterile field and just pull it right up here. So that way I have plenty of, you know, leadway here to do what I need to do, but also I'm not reaching all the way across one way or another to reach for the items I need. So the next thing in my box here is my sterile gloves. So because of the circumstances, I'm going to have to touch my phone to move it to where you can see me doing my sterile gloves over here on my table. And then I'm going to have to move it back after I have my sterile gloves on, and I realize that is completely contaminating the field, and that would not be okay in any circumstances. So I'm going to go ahead and I'm going to move this over here, and I'm going to sterilely get my gloves out of here. And the outside is clean, but the inside is sterile. So now I'm going to set this here, and I'm going to let you watch me while I put on my sterile gloves. So I have to open this, and like I said, the outside is clean, but the inside is sterile. So I just have to make sure I'm only touching these outside flaps. And so I want to make sure that I am touching, I'm gloving my dominant hand first. So I am just going to take my thumb and my finger, and I'm going to make sure that I'm doing palm up, thumbs down to apply my glove. Now that I have this glove applied, I want to do my non-dominant hand. So I just want to kind of grab this cuff here, and I want to do my very best to glove this hand while not contaminating the sterile field. So now that I have these on, I would keep my hands above waist level at all times and only touch what is sterile. So I would not, touch any part of my glove that is not sterile, even if it is messed up. I'm just going to leave it and go with it for the entire procedure. So obviously I have to move my phone back to finish the video, so I'm going to do that at this time. And I realize it is contaminating the field and that I should not ever do that under any circumstances in the real situation. So I'm going to have to move my client's logo. So I'm going to scoot my client's leg over a little so you can see. This is also contaminating the field, but I want you to be able to see what I'm doing. So next I'm going to apply my sterile drape over the area. And so you want to make sure you don't touch anything but laying the sterile drape there. You don't want to touch anything of the skin, nothing but that drape. So now that that's done, I'm going to set this up a little better. So I'm going to lay out all my supplies. I have in here, I have a specimen cup. I have my normal saline, 10 milliliters to inflate the balloon with. I have my lube. I have iodine swabs. And then I have my Q-tips because I'm going to be using those instead of iodine for the purpose of the circumstances. So before I get started, I want to make sure that I am prepared in every situation. So that way, whenever I'm ready to insert that Foley catheter, I don't have to worry about, grabbing the saline and having to connect it to the tube. Like, I'm going to make sure that I do everything before, so that way it does not cause an issue. So I'm going to make sure I connect this. I am going to go ahead and I'll just kind of lay this here. We'll say I have my lube in there, but so that's going to have to lay there for a second. So I would have my lube here, and I'd squirt it all over my catheter. Due to the circumstances, I'm not going to do that. So now that I have everything ready and I'm ready to insert the catheter, I'm going to clean the area first. So I'm going to use my non-dominant hand to spread the labia, and I am going to take my first cotton swab, iodine swab, and I'm going to do the one side of the urinary meatus and getting the periurethral mucosa in there as well. And then I'm just going to kind of go around my sterile field and throw it away. And then I'm going to grab my next one, and I'm going to go on the opposite side of the periurethral mucosa in around the urinary meatus. And I'm going to again go around my sterile field and then throw it in my trash. And then lastly, I'm going to go down the middle. So this is going to be in one downward stroke. So I'm doing one downward stroke with each cotton swab that I'm putting to the urethra and around the urinary meatus. So now I'm going to just go around my sterile field one more time, throw it away. So now that that's all sterile, I am now going to you want to try to wrap the catheter in your hand the best you can. And I'm going to now insert the catheter. So you're going to feel a little pressure. So just make sure you bear with me, and I'm going to get this done as fast as we can. So I'm going to just stick this in using my dominant hand and not touching anything but that tube. Touching anything but that tube is going to contaminate my one sterile hand. So I'm using my non-dominant hand to hold the labia open. So I now see a splurge of urine, knowing that I'm in the bladder. So I can go ahead and inject my normal saline. And now I'm going to make sure that I feel some resistance. So I do. So now I'm going to push the catheter in another inch. So now that the catheter is inserted another inch, I will now tape the catheter to the leg so that way it is stationary, and I will hang the catheter bag below the patient's waist level. So I can now let go. It's already taped and it's below waist level, and my gloves are dirty, so I'm going to remove my gloves and dispose all of my equipment. I'm going to make sure the client has its bed in the lowest position and that I place the call light there. But before I do that, I would of course clean the client and remove all of the remove all the iodine off them and do pericare. So that concludes my Foley catheter video.